Hi everyone, this presentation covers Chapter 2 on selecting a research question in the third edition of Jacobsen's textbook, Introduction to Health Research Methods, a Practical Guide. In this chapter, you will learn that selecting one focused study topic is the first step towards completing a successful research project. Here is an outline of the chapter. Section 2.1 covers practical research. Section 2.2 covers brainstorming and concept mapping. Section 2.3 covers keywords. Section 2.4 covers exposures, diseases, and populations. Section 2.5 covers PICO, or the PICOT method. Section 2.6 covers inquiry and research. Section 2.7 covers testable questions, and Section 2.8 covers framing for generalizability. Section 2.1, practical research. So good research questions in health sciences arise from different observations that have been made during applied practice. A good first step towards selecting a research topic is to think about the various questions about health that arise from many different aspects of your life. So you can think about your personal experiences. This could be family history. This could be from coursework. This could be a class that you take where a professor is really interested in a topic that may pique your interest. It could be from clinical or public health practice. It could be from informal reading about subjects of interest. I always think about, whenever I look at this topic, about my personal experiences. I personally became interested in prevention and cancer screening after I had someone in my family who had breast cancer. I'm also very interested in cognitive health and aging as I get older and my parents get older, and the implications of various risk factors on health there. For coursework, I became very interested in the Middle Eastern and North African population based on my prior coursework when I was in school. I also worked with residents in the past who became very interested in health topics based on their practice. So, for example, I worked with a resident, her name was Emily Jolly, and she conducted a study looking at breastfeeding among African American females. And she actually looked at how males' perceptions of breastfeeding influenced the mother's likelihood of breastfeeding. And they learned that based on their experiences in the hospital. So research really should come from these different experiences that people have in their lives. And so these practical questions that you can think of when trying to think of a research project, say for this course, for your research topic, or for any others, is to ask yourself the who, the where, the when, the what, the why, and the how. And really, you want to think about how these questions sort of generate things that may be in need. They lead you to think of ways that you can look for an unmet demand for descriptive studies, needs assessments, program evaluations, clinical effectiveness studies, and other health-related research. So Section 2.2 covers brainstorming and concept mapping. And these are some different techniques that you can use to help solidify a research question. So brainstorming really is the broadest approach, and this is really the process of just generating a long list of spontaneous ideas about possible research questions. This can be anything under the sun. You come up with an idea and you write it down. Concept mapping is really a way of taking these ideas that are brought out in brainstorming and putting them into different themes. And so it's a visual method for listing ideas and then grouping them to reveal relationships. And so oftentimes in a brainstorming session, you may come across an activity where you are asked to generate a list of words or phrases. And then you would use circles and arrows to group related topics and visualize the connections between them. And a good way of doing this is just by using Post-it notes. And you can use different colored Post-it notes, or you could use the same color Post-it notes. And so you can take a specific topic and write it down on a Post-it note. And then when you have multiple of those topics, you can group those Post-it notes together. And then you can sort of look at the different relationships between the different topics. And so figure 2.1 goes over some different brainstorming questions. And so Jacobsen really goes over some different areas to think about when you're brainstorming for research. Things like your interests, aptitudes, applications, and mentors. And then some specific questions to go for each. So for example, interests. What are my interests? What health-related conditions have significantly affected me, my family, my friends, etc.? Aptitudes. What knowledge and skills do I already have? And how can I build on those knowledge and skills? And what can I learn to improve those knowledge and skills? Applications. What studies would help improve health-related practice or policies? And what are the gaps in the literature that I can fill? This is very important when you're conducting a research study because you don't want to replicate something that's already been done. You want to fill the gap or enhance what research has been done before. And mentors. If you're going about conducting a research study, you want to work with people that can help you. So your supervisors, professors, or any other mentors. Section 2.3 goes over keywords. So a keyword is a word or a mesh, which is a medical subject heading, or a short phrase that you can use in a database search to try and find research articles. So you come up with an idea about a topic, and then you really need to see if it's been done before. These words in a search in a formalized systematic fashion can help you identify the full extent of the research area and what the scope of your research needs to be in order to fit within that research. So it helps you really solidify the themes that can emerge from your brainstorming and concept mapping. Section 2.4 goes over exposure, disease, and population research questions. So there are different ways that people will phrase questions in public health, in medicine, in clinical versus non-clinical settings. And in epidemiology, we typically like to look at a exposure disease population format. And so research questions are often expressed in a formula similar to this. Is the exposure related to the disease or outcome in a population? So looking at research at race and ethnicity, so is someone's race and ethnicity related to their cognitive health among older adults in the United States? Is whether or not someone receives a preventive screening related to prevention or diagnosis of a disease in a certain population? So your exposure is what you're looking at as your independent variable to see if it influences an outcome or disease in a certain population. And so what is that exposure? That exposure is a personal characteristic, it's a behavior, it's an environmental encounter, or an intervention that might change the likelihood of developing a health condition. So this is often called the predictor, or as I just mentioned, the independent variable. So it could be looking at whether screening prevents late diagnosis of breast cancer. It could be whether receiving a vaccine reduces your likelihood of having severe symptoms of a disease. It could be whether a diet and physical activity intervention reduces someone's likelihood of having a cardiac event, and so forth. And so figure 2.2 goes over several different examples of types of exposure. So Jacobsen goes over socioeconomic status, so things like income, wealth, education level, age, sex, gender, race, ethnicity, nationality, etc. Other things that could be looked at as exposures are health behaviors, so dietary practices, exercise habits, alcohol and tobacco use. Health status, so things like nutritional status, immune status, genetics, stress, etc. And environmental exposure, so like drinking water, air pollution, radiation, noise, etc. So then moving on to disease in our exposure disease population format, this is the observed event or outcome of interest. So this is the presence or absence of the disease. This could also be the adherence to a health behavior guideline or health service utilization. So you could look at the racial and ethnic differences in flu vaccine uptake, or it could be cancer screening, or it could be whether or not someone actually has the disease of interest. And it's a measured out endpoint in an experimental study. So if you're comparing a control group to an experimental group, say you gave someone a certain medication and you compare that to a placebo, or you compare that to a previous medication, then the outcome at the end is the disease in this formula. So figure 2.3 goes over examples of types of diseases. So some would be the infectious and parasitic diseases. There are also non-communicable diseases, so these are more of the chronic diseases, neuropsychiatric disorders, and injuries. Then the population really is the group of individuals, communities, or organizations under study. So figure 2.4 gives some examples of these types of populations. So they can be very specific to place and very specific to age. It could also be specific to gender, or it could be a little more broad. So here we have Australian children younger than 5 years old, or it could be women living in rural Ontario, or it could be more general, like adults with diabetes. Section 2.4 goes over types of prevention. So the first type of prevention is primary prevention. These are health behaviors and other protective actions that help reduce the risk of an adverse health event from occurring. And individuals here have not already had the condition. So primary prevention is nutrition, physical activity, sleep, vaccinations, seatbelt. Someone does not already have the disease. Whereas secondary prevention is really early detection. These are detection of health problems in asymptomatic individuals at an early stage when the conditions have not yet caused significant damage to the body and can be treated more easily. So examples here could be cancer screenings, blood pressure checks, or routine vision and hearing tests. Then tertiary intervention or tertiary prevention is the actual treatment. So these are interventions that reduce impairment, minimize pain and suffering, and prevent death in people with symptomatic health problems. So examples here could be rehabilitation, palliative care, medications, and surgery. Now, section 2.5 goes over a different framework. So I mentioned earlier on that epidemiology and public health uses a different framework that's often used in clinical practice. And one of the frameworks that's used in clinical practice is called the PICO. Sometimes people call it the PICOT method or PICOT method. Doesn't matter how you pronounce it, but this is really a way of developing clinical research questions and designing intervention studies that may serve as a foundation for evidence-based practice. And so here, your P represents a patient or a population. Your I represents the intervention, which could be very similar to the exposure. And the C represents the comparison or the control, and these are really people who are not exposed to the intervention. Then your O is the outcome, which is similar to the D in our format, and then here we also have a T for time frame, which is sometimes in the PICO method and sometimes not. and typically it's not included in the exposure disease population question. It's all looking at research questions in the same way, but it's just framing it specifically to a clinical intervention. So section 2.6 goes over inquiry and research. And this section really just talks about how when you conduct a research study, you're starting off with an inquiry, and then you're creating some sort of research out of it. Inquiry is the process of finding answers to questions that arise from personal experiences. It involves identifying a practice-related question and thinking about possible answers that align with your own experiences and observations. And so from there, you're starting off with a question, and then you may start to do some online searching to try and find some ways to support your ideas and come up with some different hypotheses about it. Now, from this inquiry, it should reveal some sort of evidence gaps. And these are things that you want to look more into in more further formal research. Now, sometimes these personal inquiry projects can actually end up being a quality improvement type project. And quality improvement projects really are very important and very specific to clinical practice. And really, it's similar to how it's written. So a quality improvement project is the type of project that's trying to improve the quality of a service provided to the patient. And a very basic example of that is improving wait times. So if you're trying to reduce the amount of wait times, what is a very simple way of reducing wait times? Okay, well, it could be having people check in earlier, or it could be having everybody fill out their forms before they come into the office. It could be having a different time limit between patients. It could be hiring more people. So it's a very, very basic, low-hanging fruit type project. And so really, whenever you have some sort of inquiry, it can produce this type of basic project, but it also can lead to new research that comes into this full research process in order to generate new knowledge to be considered research. So section 2.7 goes over testable questions. So when you have a good research question, it should end in a question mark, but it should not be framed in terms of a value statement, like mental health is important or tobacco use is bad. A research plan should not be formed based on any predetermined call to action, like people should exercise more, or nutrition should be a mandatory part of middle school curriculum. Research questions are systematic. Research questions are testable. They should be ones that should be answered through data collection efforts, like pre-post interventions, Likert scales, self-reported questionnaires, and not something that is already written out, not something that you already have a preconceived notion about. And so that is one reason why we use this exposure disease population format to create a testable question. And this makes it much easier to find a way to measure each one of the components of this format. Format being, is your exposure related to the disease or outcome in the population? And so within your research methods course, you will create these types of questions for your secondary research projects, as well as your group research projects, and hopefully you will continue to use this method as you do research for any other classes or in your future career in public health. Section 2.8 goes over framing for generalizability. Research findings should be able to be generalized to other populations beyond the study population. And so an example that Jacobsen gives is that an exercise intervention for students in one high school should be developed for replication and tailoring in other high schools across the country. So within your research methods course, if you're working in a group and working on a group project, it may be that you do this project on students and students at your university. Now, what you want to try and do is have a topic that can be generalizable to other populations beyond the study population. And it may be that it's not going to be generalizable to every other university in the country, but it may be generalizable to universities that are similar to yours. It may be generalizable to, say, an urban institution that is minority serving, if that's what your institution is like. Okay, so that is it on Chapter 2. Thank you for listening.